So if we want to understand hearing loss, it's first important to understand how the hearing system works. Sound comes in through the external ear and goes through the ear canal and reaches the eardrum. The eardrum vibrates with that sound pressure, and those vibrations are picked up by 3 small hearing bones in the middle ear. Those vibrations from the hearing bones are then connected to the microphones of the inner ear. These are very, very small cells that take sound energy and translate it into electrical energy. That electrical energy is then taken along the hearing nerve to the brain, where it is processed for word understanding. There are several different kinds of hearing loss that a person can experience. The 2 common kinds we talk about are conductive hearing loss and sensory hearing loss. Conductive hearing loss is something as simple as wax that's occluding or blocking the ear canal. Another common cause of conductive hearing loss, where sound does not get to the inner ear, is when there is fluid behind the eardrum. This is a very common cause of hearing loss in children. In adults, a very common cause of hearing loss is something that is called sensory hearing loss, or hearing loss that affects the inner ear. And this hearing loss can be coming from problems with the microphones of the inner ear or the nerve that takes information to the brain. So we have 2 kinds of hearing loss: conductive hearing loss and sensory neural hearing loss. There are several treatments for hearing loss. If the hearing loss is coming from fluid behind the eardrum, such as little children get with ear infections, the treatment is drainage of that fluid with a small surgery. If the hearing loss is coming from arthritis of the hearing bones, which is a common cause of hearing loss in an adult, that can be also fixed with surgery. If the hearing loss is coming from loss of the power of the microphones of the inner ear, then hearing aids are the best treatment for that type of loss. Sometimes a person's hearing loss is so severe, that is, they have a profound hearing loss, that even a hearing aid is difficult to bring the hearing back. In that case, we have a procedure called cochlear implantation, where we implant a special hearing device into the inner ear, which allows someone to hear very well despite having a profound hearing loss. If you think you have hearing loss, the most important thing is to go to your doctor and have your ears evaluated.